Gerbiami kolegos, sveiki atvykę į pirmosios neformalios ministrų tarybos pirmąją spaudos konferenciją. Tikiuosi, kad šitas malonus faktas paskaitins jūsų darbo dieną. Kalbant apie darbus, šiandieną jūs girdėsite Lietuvos Respublikos sveikatos reikalų ministro Vytenio Povilo Andriukaičio ir ES sveikatos ir vartotojų reikalų komisaro Tonio Borg pristatymus apie šias kelias dienas, apie neformalią sveikatos reikalų ministrų tarybą. Norėčiau priminti formatą, kaip jūs supratote, pirmą kalbės ministras Andriukaitis, paskui komisaras Borgas. Yra kalbama, ministras kalbės lietuviškai, jeigu salėje yra užsienio žurnalistų, jų klausimai bus išversti ministrui. Komisaras atsakinės anglų kalba, jo atsakymai bus išversti į jūsų gimtasias kalbas. Noriu priminti, kad šitas kelias dienas mums pavyko nuosekliai laikytis darbotvarkės, kuri šiai spaudos konferencijai numato pusę valandos, tai yra 30 minučių, todėl raginu jūs visus
There is a limit of time for us here now. We have 30 minutes, and I ask you to put the most topical issues that concern you in relation to the work done during our informal council. Mr. Minister. Thank you. Commissioner, dear reporters, today you have concluded a two-day informal council of the Ministers for Health. It was the first informal council during the Lithuanian presidency, and I would like to take this opportunity to thank the Commissioner Tonio Borg and EU member states, ministers and delegations for the joint work. In fact, we discussed three issues. First, sustainable health systems. Second, mental health of older people. And third, smoking prevention among young people. You know well that healthcare systems in the European Union face many challenges today. And we have common challenges. I could name four of them. First, demographic changes, then exposure of our public finance, third, introduction of new technologies, and last but not least, growing inequality in the use of health services. Member states, to ensure access to a qualitative health care and make it affordable, have to find ways to overcome the mentioned issues, because indeed only sustainable health systems can help us find solutions to all the issues. What is a sustainable system? It is an effective health system, or it must be effective in order to be sustainable. Also, such a system should be based on the rational use of resources, and their budgets should be subject to stringent supervision and should be well balanced. The systems should use modern management principles. They should ensure broad accessibility to health care services through reforms. Their governance should be based on restructuring and not on reducing the scope of health services. As regards reduction of our budgets and hence reduction of healthcare services, these two things may pose enormous danger to the European Union in the future. Also, we have discussed introduction of new technologies and agreed that they must be qualified as investment and not as expenditure. Healthcare sector is very open to innovations, innovative solutions, but you always have to strike the balance between introduction of innovations and solidarity, because at the core of all these changes stands man. The Commission has promised us assistance and proposed to use the experts group, which was recently established, as a platform for exchanging information and ideas. During our informal council, we heard a number of valuable ideas. Our last discussion was related to the efficacy of medicines, and the Commission once again proposed to use the service of the high-level expert group in order to ensure greater price transparency of medicines. We also discussed mental health of older people. 11% of the EU population suffer from mental disorders. At least 10 to 15% of people above 65 years old suffer from depression. Over 5 million of people in the EU suffer from dementia. Senior citizens also belong to the suicide risk group. We have discussed the need to eliminate the stigma, to integrate better people with mental disorders into our communities. It is absolutely clear that today we have to be fully aware that aging society has to maintain high life quality standards. Certainly, people with mental disorders usually leave the labor market quite early, and this means additional economic losses. But not only economic losses, because we lose their skills and their experience. Early retirement, followed by the difficult situation, means that costs for us, the taxpayers, might increase. Therefore, we have to protect any person, any senior citizen from landing in a very difficult situation, and we have to find ways for fighting their problems. We need programs for inclusion of older age people into the labor market. We have to develop strategies for healthy aging. We have to reduce stress at working places, and needless to say, we have to integrate into society such people. We also discussed the issue of youth smoking and defined and stated that the situation today is indeed alarming. 18 million of people smoke today. The industry is in a constant search of new methods for bringing up future consumers. 70% of smokers took up smoking before they reached the legal age, that is the age of 18. 94% of them started smoking before 25. And indeed, the problems are very alarming, and statistics as well. Over 100 million people died in the EU because of smoking. Actually, this is the number of those who died during the two world wars. Therefore, new marketing methods developed constantly by the tobacco industry are enormous challenge for us. For example, today they produce tobacco products with different flavors, in different packaging. They also search for ways to influence the choice of young people through modern IT technologies, modern devices. We also stress that the European Union should respect its international commitments, namely, Framework Convention on Tobacco Control should be implemented. Youth smoking reduction programs should be broad in scope, and they should cover children, teenagers, and school communities and such. Member States now, during the European Year of Citizenship, should promote such initiatives as smoke-free environment. Marketing measures used in the digital space are very aggressive, and we need to find preventive countermeasures to them. So these are all the issues we discussed during the 2 days informal council. All member states were very active in their discussions and introduced their positions. Thank you. Thank you, Minister. And now it is my pleasure to give the floor to Commissioner Tony Borg.
Thank you very much, and thank you, Minister, for these opening remarks. Why do we organize informal health ministers' councils? And of course, the operative word is informal. So the idea is to have a free exchange of views without taking binding decisions. These could prove to be even more important, these meetings, than when we actually take the decisions. Because it is a good orientation debate amongst those who are politically in charge of our health sectors in Europe on a number of topics which are usually decided by the Presidency after consulting the Member States and the Commission. So it was obvious that one of the first items on the agenda had to be the sustainability of our health systems. Are our health systems sustainable? And the answer is yes, they are if we reform them. So let us take the positive attitude. I'm not saying no, they are not. They are sustainable, provided each member state reforms its health system, and that remains a question of decision by member states. The Commission will never tell you do this or do that. What the Commission suggests, and also the Council, I shall explain why the Council is involved in it as well, is if you continue in this direction, you are going to face problems. And this does not apply only to those countries which do have serious financial problems to the extent that they have been put, this is the jargon in the EU, under programme. This applies also to other countries who have a relatively sound financial basis, but who need to reform their health systems. So when we issue the so-called country-specific recommendations before summer each year, and you look at the list of those countries where the recommendations relate also to the health sector, you'll find countries who have never had a bailout, do not need a bailout, and yet they need to reform their health system. So we have to find these means of cutting costs, but spending in a more intelligent way, without prejudicing healthcare. The main mantra which everybody mentioned in the Council was the economic crisis should never be a health crisis, or it should never degenerate into a health crisis. So perhaps I could just change what I just said, rather than necessarily cutting costs, spending more intelligently, spending in a smarter way. And there are ways and means of doing this. E-health is one of them, which was mentioned by practically every delegation, how we can develop more e-health, and the Commission will help because we have a network on e-health. We are introducing guidelines on patients' records. What should the minimum rules be on the information which should go into patients' records? The possibility of a prescription being recognized in other member states. So these things which will help the citizen, which will cut costs and at the same time provide basic healthcare to everyone. And let's not forget that there are still huge inequalities within the European Union as regards health matters. And the second item, as the Minister said, was mental health. Just a few figures without sounding pedantic. 5 million citizens in the European Union suffer from dementia. 8 to 10% will suffer or have suffered from some kind of mental disorder. With all the stigma that relates to mental disorder, because there are different kinds of mental disorders. And yet the stigma continues to the extent that citizens do not admit that they have a mental disorder. I am deliberately not using the word illness because there are different kinds and grades of disorders. Probably at any minister, at any moment in our time, particularly those who are in politics, and I was in politics for a very long time, we feel sometimes paranoid that everyone is against us. And so long as it does not last long, it is very natural for politicians to suffer from that. But depression, for instance, is very common in stress-related jobs. Most delegations in their surveys showed a very high percentage of people who feel stress, even as high as 50%, probably in politics is 100%. But these, if they are continuous, they will lead at old age to mental disorders, mental illnesses, depression, which is linked to solitude as well. So these items were discussed, not only from an economic productivity point of view, as if we are a clog in this economic machine and we have to oil it, so it is important to have healthy citizens. No, health is a value in itself. Longevity is a value in itself. We take pride in the fact that life expectancy all over Europe is increasing. Of course, it has to be a healthy life expectancy, but it is increasing, and that is a value in itself. If, of course, having healthier citizens means better economic production, increasing the employment rate to 75% between 20 and 64 years of age, well and good, as a secondary argument. But the main argument should always be that health is a value in itself. And recently, the Commission, for instance, has launched a joint action on mental health with 25 member states under the guidance of Portugal, which helped a lot in this respect. And last but not least, the Latins would say dulcis in fundis. I hope my Latin pronunciation is correct, is how do we prevent the young from being attracted to smoking. As you know, we are revising the Tobacco Directive. The Commission launched this Tobacco Directive in 19th of December of last year. I am happy to tell you, of course you know it already, but I want to repeat it, that on the 21st of June, the Member States, under the Irish Presidency, but also with the support of the future, now the current Lithuanian Presidency, achieved a common approach on the directive. Tomorrow, the European Parliament will have its first vote in committee stage on the directive, and a further vote at the plenary in September. And in the meantime, the Lithuanian Presidency will have this arduous task of trying to combine different positions and come out with an agreement, hopefully towards the end of this year, so that the directive will be approved before the end of the current parliamentary term. So what we discussed, not to have a repetition of the 21st of June meeting, during the Health Council, this informal Health Council, which does not take binding decisions, was what can we do apart from the Tobacco Directive to make smoking unglamorous, uninteresting, unacceptable, and unavailable to children and young people. I remind you that 70% start smoking under the age of 18 and 94% under the age of 25. And the worrying thing is that the rates of smoking, even though it's no longer the in thing to do, as in my young years, when I was young, but yet the rates of smoking by 15-year-olds have increased in some parts of Europe. And we still have different rates of smoking in the European Union, ranging from as low as 24, the average would be 27, 28, to as high as 40% in some member states. So what other means can we do to limit advertising? We already have EU laws forbidding advertising of tobacco and sponsorship of international sports events. We have a Council recommendation, not a legislation, Council recommendation of 2009 on smoke-free environments, which calls upon member states to protect particularly young people against passive smoking. And many member states today have laws forbidding smoking, even though there are differences between member states. And another recommendation of 2002 calls on member states not to sell tobacco to underage people and prohibits sweets or toys resembling tobacco. So we discussed how we can implement the WHO Framework Convention on Tobacco Control, which has been signed not only by all the member states, but it has also been signed by the European Union as an institution itself. One other activity which we shall be organizing, this is organized on an annual basis by the Commission, is the campaign Ex-Smokers Are Unstoppable, a campaign to help people quit and to showcase that life is better without tobacco. And I'm very happy to note that today all the health ministers or their representatives described what they were doing in their countries and that they intend to do more in the coming months. Of course, I have full faith in the Lithuanian presidency in trying to conclude the tobacco directive as soon as possible. Thank you.
Dėkoju ministrui ir komisarui už
Thank you,
pristatymą.
Mr. Minister. Thank you,
Gerbiami
Commissioner.
kolegos,
Dear colleagues,
klausimai.
now the time has come for
Jeigu galima,
questions, and
klausimai
please
prisistatyti
introduce
iš
yourself
žiniasklaidos
before
priemonės.
placing a question.
Pradėkim
So,
drąsiai.
who is the first to break the ice?
Ačiū,
Thank
labą
you.
dieną,
Vaidotas
Vaidotas Beniušis iš
Beniušis,
BNS naujienų
BNS
agentūros.
News Agency.
Ponas
Mr.
ministras,
Minister,
užsiminėte apie
you
elektroninės
have briefly
cigaretės
mentioned
ir kaip tik tas
e-cigarettes.
klausimas vėl gali iškilti
The issue of
diskutuojant Europos
e-cigarettes
parlamente
might
dėl tabako produktų
emerge
direktyvos.
while negotiating
ministro,
the
tiek
tobacco
komisaro
directive
norėčiau
with the
klausti,
European Parliament.
pasikeisti
So my
dabar
question
direktyvoje
is,
esantis
how
tekstas,
much you
reguliavimas ir
think
ką jūs
the
atsakytumėte
current
tiems,
rule in the
kurie
directive
argumentuoja, kad
might
elektroninės
change,
cigaretės
especially
yra gera
given the
alternatyva
argument
tradicinėms
that
cigaretėms ir
e-cigarettes
dėl to gali
is a
sumažinti
good
žalą.
substitute
Taip pat
to the
jūsų
traditional
lūkesčiai dėl to,
cigarettes
kada jau
and
direktyva
may
galėtų
help
būti
us
galutinai
reduce
patvirtinta
the
ir įsigalioti.
damage.
Dėkoju. Apibendrinant šios dienos neformalią tarybą, galima pasakyti, kad
During our informal council, we have witnessed the following. The general approach of all the member states is absolutely clear. Smoking kills.
visiškai nesvarbu,
And it doesn't
ar
matter
galima pridengti jį
whether
elektroninę
can
versiją,
mask
sakant, kad
it
taip,
by
elektroninė versija mažiau
using
galbūt
some
kenksminga
e-version
kaip tiesioginis
product
tabakas, arba sakant,
by
kad
stating
tai galbūt
or
yra
arguing
mažiau
that
nikotino,
e-product
galbūt tai
is
gali
less
būt traktuojama
harmful,
kaip farmacinė
or
priemonė.
by
Bet vis tik
saying
tai
that e-product
sveikatos ministro
can be made
atsakymas
equal
šiandien buvo,
to a
kad
pharmaceutical
taip, rūkymas
product.
žudo.
All of us
Kita
think that
vertus,
smoking
manau,
kills.
kad diskusijose Europos parlamente
Also, I
turbūt bus
believe
labai
that
įvairių nuomonių.
during our discussions with the
palauksime,
European Parliament, we are
tos
going to
balsavimo
hear the whole
pagrindiniame,
range of
komitete.
opinions. So maybe we have to
Ir,
wait
kiek žinome, nuomonių gali būti
till
labai įvairių,
the
nors
discussions
pagrindinis komitetas yra labai aktyvus,
which are going to
ir
take place
palaikė,
tomorrow
pilna apimtim
in the EP
palaikė,
responsible
kiek
committee.
galima, platesnės priemonės,
Because
eliminuojant
indeed,
rūkymą iš Europos
usually everybody
žemėlapio
supports
ir
broad-ranging,
ypač iš
broad
šildymo
scope
etapo.
measures for
Tai,
smoking reduction.
Kadangi teks diskutuoti
No doubt.
Europos
We will have
parlamente poryt, komitete,
to discuss this issue
pristatyti
tomorrow or the day
pirmininkavimo
after tomorrow
prioritetus ir mūsų tikslus.
at a
Aš
respective
manau, kad mes turėsime
EP
ieškoti bendro
committee,
požiūrio ir,
and
žinoma,
therefore we will
trialogas,
have
kuris
to see
prasidės po
for
rugsėjo
common
11-osios
points of
balsavimo
interest.
Europos parlamento
The more so
plenarinėje
that we are going to
Jis
have trialogues,
gali atverti
and this issue should be
dar visą
voted
lauką,
on in the plenary
trialogo
session of the European Parliament in
kontekste
September.
diskusijų. Bet
So
manau,
it is a
kad
very broad context. context. But I believe that the general approach that was agreed upon by the member states during the Irish presidency is a solid foundation for making further headway. As regards my personal expectations, I believe that the European Union is capable to reach positive result in the trilogue and finally adopt the directive. That would be a very good present to the whole of Europe and, last but not least, to those who are going to run in the elections to the European Parliament, to their campaign. We hope that we will be able to complete work on this dossier, and this is our optimistic scenario. So we hope to conclude all the work in December or by December. Thank you. I see that Commissioner would like to add a few words.
Just something briefly to complement what the Minister has said. We are not prohibiting smoking. We are not prohibiting e-cigarettes. This is extremely important. So the choice remains that of the individual, whether to smoke or not, and whether to smoke e-cigarettes or not. So we have no crusades of prohibition. This is extremely important. Which does not mean that the European Union and the Member States do not have an interest to regulate smoking, including e-cigarettes. And I can give you figures to show that 32% of those who smoke e-cigarettes never smoked before. So one can take the approach, but they would have smoked cigarettes and it's better to smoke e-cigarettes, or another approach that possibly they could not have smoked at all. And with e-cigarettes they are smoking because it gives a false sense of security because you are smoking without smoke. In fact, I can't probably use the verb smoke as regards e-cigarettes because there are no smokes, but there is intake of nicotine. So what we have suggested, because this is just our proposal, that it's up to the Parliament and to the Council to agree on this, is to fix a threshold. Below that threshold, e-cigarettes would be considered like a consumer product. You just buy it. Above a certain threshold of nicotine, then you need to have an authorization. So this is the proposal as it is. Whether the threshold will remain there or what kind of threshold, it would depend on the negotiations between Parliament and Council. In Parliament there are two conflicting points of view. One which is we need authorization for all e-cigarettes irrespective of threshold, and the other which is the opposite, let e-cigarettes alone and consider them like they are today as merely as a consumer product. I believe, as in most things, that the truths and the best course of actions lie somewhere in between, which is the Commission's proposal right now.
Andrew Sitas, Reuters News. I have a question for both Mr. Borg and Mr. Andriukaitis. Do you believe that tobacco product regulation needs to be stricter than the current directive draft? For example, do you believe that down the line plain packaging of cigarettes should become the mandatory requirement in the EU countries?
Okay. Thank you for this question, because the directive expressly provides that member states can take more stringent measures if they want to, including plain packaging. In fact, Ireland, even before the directive has been approved but only launched, has decided to go for plain packaging. Now, just to inform everyone what plain packaging is, it's not plain at all. It means that the tobacco product, the tobacco cigarette packet, is full of warnings, pictorial and written, and that the trade name is the only thing which indicates that this packet of cigarettes belongs to this company and not to the other, and they are all written in the same way. So no special colors which one connects to a particular brand, no special features, everything will be the same. there's nothing to stop you once you buy the cigarettes to put them in your own cigarette box, or you don't look at the health warnings and nor at the plain packaging. Till now, only Australia has implemented this kind of plain packaging, and New Zealand has proposed legislation in this regard. There was domestic litigation in Australia, which the Australian government won, and now there is litigation before the World Trade Organization against Australia. My hunch is that if this litigation, international litigation, is won by Australia, it would pave the way for other countries, including in the European Union, to introduce plain packaging. And that is not prohibited in the directive. What we are introducing in the directive is a minimum percentage of the surface area on both sides of the tobacco packet to contain health warnings, and for the first time it shall be mandatory to introduce pictorial warnings, and for the first time it will be not just on one side of the packet but on the two sides of the packet. And we introduced this and not plain packaging because we thought, and rightly so I think, that this stands a better chance of approval by the co-legislators, because after all, whatever the Commission proposes ultimately has to be approved by the co-legislators. So it is useless proposing something which would not be approved. Indeed, the common approach by the Member States has been to reduce that 75% to 65% in order to get a wide consensus by Member States. So I don't think that the Member States would have opted or would opt, although I cannot know what will they do in the fullness of time, for mandatory plain packaging. So the compromise was, in the directive as we launched it, to leave that in the discretion of the Member States. They would have to inform the Commission so that we see that there aren't any hidden agendas on this plain packaging, but otherwise they can introduce this, as some countries have already declared that they will do so. And I believe that if Australia wins the international litigation, more European states will declare their intention to introduce plain packaging.
Ačiū už atsakymus.
Aš norėčiau tik papildyti,
Can
kad
I
iš tiesų, kaip
say a
matote,
few words on my behalf?
kad
Indeed,
taryboje jau
the
pasiektas
Council has already
bendras
reached
sprendimas
general approach
ir jisai įjungia
within
įvairias
certain limits of
kompromisų ribas.
compromise.
Ir šiuo atveju iš ties aš
And then
manau, kad
I
šalių
believe that
narių nacionalinė
the
teisė
national laws
leidžianti
of member
reguliuoti
states which
daugiau
allow for
ir
stricter
griežčiau
regulation
yra
have been
išsaugota ir šalių
preserved, so
narių
member states
galimybės
can
dar griežčiau reguliuoti tuos
continue
klausimus
regulating in a more
išlieka.
stringent way.
Aš manau,
So
Airija
Ireland, which
žengianti
is
labai
taking
aktyvius
very
žingsnius,
active
manau, gali
steps,
paskatinti ir
can
kitas šalis narės. Man
serve as a source of inspiration to other member states. Now,
pirmininkaujančios visoms
Lithuania,
28
which is presiding
visų
over
28
all the
šalių narių vardu,
28
aišku,
member
teks
states,
žiūrėti
will have to
labai
take
atidžiai, kokie
close
kompromisai
look at
tarp
the
Europos
compromise
Parlamento, Europos Tarybos
to be achieved
ir
among the
Europos
European
Komisijos
Parliament,
bus-
the European
bus
Commission, and the
pasiekti.
Council. Thank
Dėkui
you.
ministrui už savo laikį
To the
papildymą.
minister, any
Kolegos
more
iš
questions from
auditorijos
colleagues?
klausimai toliau.
Nerijus Bražiūnas, Health Code, Baltic TV. We know that a very important determinant of prevention of young children from smoking is physical activity. What are preventional programs of physical activity which are in the pipeline and to be implemented as of the new school year?
Gal galėtų ministras?
Perhaps just a brief comment on this, but it's important. We have a strategy on chronic diseases. And with the exception of cancer, we don't have specific strategies on specific chronic diseases, except for cancer. We fight the risk factors relating to chronic diseases, which are four, in our opinion: lack of physical activity, tobacco consumption, alcohol consumption, and nutrition. So this is an important aspect if we want to prevent chronic diseases, or at least postponing them, because the current situation is worrying. Cardiovascular diseases are on the decline thanks to the new medicines, which are particularly the cholesterol control drugs, etc. But if you look at diabetes, this is not just a southern problem. It is a problem which is on the increase in several member states, the affluent and not so affluent member states. And what is even more worrying is that the age at which one contracts diabetes is going down as well. So we are in contact with also the education commissioner, where sport comes under culture and education. But of course, we have a great interest as the health commissioner and the health services in this respect, to increase the number of sporting activities and also obliterate once for all a stigma of the past, which today has been reduced, that in order to indulge in sports, you are going to abandon your studies as a student. I think this already has been practically removed, but we have to fight the stigma amongst teachers, amongst parents as well. And it's irrelevant. There are two rules, in my view, which we will stress on. First of all, that it is irrelevant what type of sports you do, provided you do a minimum of physical activity every day or regularly. And secondly, that it is never too late. That the human body is structured in such a way that if you regularly train and indulge in sports activity, it adapts. Not immediately, but certainly over a certain period of time to this new activity. So never too late, and the regularity of sports activity. We are working on this closely with Commissioner Vassiliou. Thank you.
Can I continue on the same vein? Indeed, member states have their national programs, they are different. Member states have their national competences in implementing programs on physical activity at schools and universities. Lithuania, as you know, has already made its first steps. We have 3 obligatory, mandatory lessons of physical activities at school per week, and Lithuania is a pioneer in this area, although Lithuania is not the only one. At the same time, we try to expand physical activity during after-school hours. Another point, which is closely connected to this area, is diet, healthy diet. Some of the ministers yesterday also mentioned healthy eating at school, introduction of these programs at school, which are closely connected with physical activities of children at school. Lithuania is taking similar steps. You know, we have programs of feeding school children in primary schools and elementary schools, and we have over 80,000 people who have participated in various health-promoting activities at schools and outside of schools. So I believe that active sporting activities, both at school and after school, will be further promoted as of September. I'm speaking about Lithuania. Other member states have various other programs. Now that we speak about activity or physical activity, please be active, colleagues. Make use of this opportunity. Do you have any more questions? You were mentioning after-school activities, extracurricular activities. If we look at the reform itself, may I ask you, schools themselves could be turned into mini sports centers after school, so that the children could come back to school after school and make use of the available facilities at 5 o'clock, 7 o'clock, 8 o'clock in the afternoon. The families will benefit and the children will be more interested in the physical activities, because our country has a lot of kinesiotherapists who could help, occupational therapists who could help. How can we proceed? Well, thank you very much for the question. Of course, the Ministry of Health is looking for all possible ways how to use the current infrastructure and current facilities. But I'd like to make use of this opportunity and remind you that we are at the press conference of the Informal Health Council. So I'd like to encourage all of you to find out more about international issues in the area. But our Minister would like to comment. Yes, indeed. This is part of the Lithuanian national policy. But again, when Lithuania was preparing for the basketball championship, we built a lot of big arenas, big sporting facilities. On the other hand, we slightly neglected smaller facilities at schools and other places, which is different from Estonia and other member states. We need to change this tradition. Colleagues, do we have any more questions? Thank you very much. Portal 15 minutes. Dalia Tiškevičiūtė. Mr. Minister, you've mentioned that valuable ideas emerged during discussions how to solve the problems. You mentioned not for one smoking prevention. Could you please give us some examples what to do in this area and how to improve the mental health of our people, of the European citizens? Yes, indeed, I mentioned that the member states, in particular those which have well-developed communities, shared the examples of best practice. For example, how the northern countries, the Benelux countries, solve the issue of integrating people with mental disorders into community life. We heard many good examples. I believe that in Lithuania, this is a topical issue, and certainly we could make the best use of that practice. But as our council is the council of 28 member states, we had to give opportunity to all of them to present their best practice or to raise their concerns. And the thing that is related to all this is not only of medical nature. We need specialists, and it's a multifaceted issue, and not only relating to medical treatment, but, for example, relating to the employment tracing. I saw another colleague who wants to put a question. Monica Petruliene, public broadcaster, news program. European Union suffers from the tensions on the labor market. If a person suffers from mental decisions, from mental disorders, is there a possibility to give specialist assistance to such people? Commissioner.
The delivery of health services remains the responsibility of member states. I'm saying this not to say that the Commission has nothing to do with mental health. I'm just stating a fact that in health matters the principle of subsidiarity is extremely strong. So strong, in fact, that the health ministers meet only twice a year to take decisions. I think that is a bit of a problem because we have a number of legislation which we need to implement. What we discuss today, again in an informal setting without any decisions being taken, is that we should not separate mental health from physical health. Let's integrate together both, and in that way help those who are suffering from mental disorders. Because the moment we separate them, first of all, we are stigmatizing mental disorders. So it's okay if you have diabetes, if you have cardiovascular disease, But if you have a mental disorder, if you're slight, then there is something wrong with you differently at a higher level than a physical ailment. So integrating both is extremely important, and therefore the agreement, again informal, the consensus was that in drafting our health policies, we should take into account the integration of physical and mental illness together and not separating them, because that would militate against providing cure to those who suffer from mental illnesses. And we discussed a number of initiatives. Some of them have already been undertaken by member states. That is to say, the subject which we discussed was more how many people suffer from mental health at an older age. In fact, statistically, 27% of all early retirement in the European Union is linked to mental disorders. But of course, these mental disorders would have started years before and not when you retire. So what can we do at the place of work in order to reduce the possibility of stress and therefore reduce the possibility of mental disorders? At a later stage, when one retires, how does one deal with solitude, for instance? This is another thing which we discussed, and therefore the introduction of not just sending a social security check, but of providing personalized services to those who feel alone. And that's why we launched this joint action on the recently, in which 25 member states are participating. And when one considers the economic negative consequences from absenteeism, from early retirement, it pays governments, this was another message which I think seeped through or down, that it pays governments to invest in mental health, also to increase productivity and save money. I know that this should not be the primary consideration. The primary consideration remains health in itself. But in these times of economic and financial crisis and problems, of course, the more you give an economic tag to what you are proposing, the better chance that that proposal will go through within the internal structures of one's government. Thank you.
Member States yesterday and today exchanged opinion and views on these issues. And what they stressed was intersectoral cooperation, better use of the funds of structural funds, better cooperation between the DGs of the Commission. Also, the Member States said that most probably there should be a kit of horizontal measures, which not necessarily should be based only on medical or economic rationale, but they could target different people and could be related to, for example, the development of urban and rural areas. So we all talked about a comprehensive way, the whole mix of tools that would help us create a favorable environment for such people. Thank you. Distinguished colleagues. Time is almost up, and I kindly ask you to ask the last question, if you have any, because we have to conclude our press conference. If you don't have questions, thank you, everybody. And needless to say, you are always warmly welcome to other press conferences. Lithuania's presidency.